Hello everyone, I am Dr. Gaurika Aggarwal, Consultant Obstetrician and Gynecologist, IVF Consultant and Advanced Gynae Laparoscopic Surgeon at Neelam Hospital, Rajpura. Today I am going to talk about PCOS and can women with PCOS get pregnant. So first of all, we need to understand the physiology of PCOS and what is PCOS. PCOS is a metabolic and endocrine condition in which there is chronic anovulation. It means that the woman is not able to release an egg every month, and as a result of which she is having irregular cycles. We find in our OPDs many women walking to us and telling us that, "Doctor, I'm not getting regular periods." Yes, this is a problem. But every woman having irregular periods a PCO? No. This condition is very much overdiagnosed. So what needs to be done? We need to first know the criteria by which we define PCOS. PCOS has been defined by the Rotterdam criteria, in which we have three things which should be present in a woman. Out of these three things, we should at least have two features. So first, irregular cycles. Second, features of hyperandrogenism, which includes acne, hirsutism and male pattern baldness. And third point is that ultrasound picture suggestive of PCOS. So a woman who is having two out of these three criteria would be diagnosed as PCO. So we will start with the pathophysiology of PCOS, where we find that there is abnormality in the hormones of the woman. So in the normal cycle, what happens is there is a rise in the FSH levels, which results in a recruitment of the follicle, and once the LH rises in the middle of the cycle, we have a release of the egg from the ovary. But in PCOS, this cycle is disturbed. There is a persistent rise in LH, because of which we have a rise in the male hormones in the body. Because of the discrepancy in the hormones, the egg is not able to release properly, and that results in anovulatory infertility. So after having understood the pathophysiology of PCOS, we should know that, does PCOS affect other organs in the body? Yes, of course, PCOS affects other organs. It leads to obesity, it leads to hirsutism, acne, it leads to metabolic syndrome, it leads to high blood pressures. It can also result in problems with your mood and lead to depressive symptoms, and also it can result in infertility, as we see in many women with chronic anovulation. So next question is, can women with PCOS get pregnant on their own? Yes, of course. Most of the women walking into your OPDs with PCOS diagnosis usually get pregnant with minor help from the doctor. What are the medications or fertility treatments available in PCOS women? So we have a number of options for PCOS women. The basic options like lifestyle management and dietary modifications help 90% of our women to get pregnant. But a few of them might require medications and IVF. First, we will talk about the basic treatment, that is lifestyle modification and dietary management. So lifestyle modification includes a change in your lifestyle, and you're going towards more of exercise, which means 30 minutes daily and at least 6 times in a week. And we can increase this to about 45 minutes a day, so that we are able to lose approximately 5 to 10% of our weight, which can go a long way in getting you pregnant. Dietary modifications include decreasing carbohydrates in your diet and also increasing the amount of proteins in the diet, and also decrease the amount of intake of food with high glycemic index. So this would result in loss of body weight and also improve the hormonal profile. Now coming on to the medications that are required for PCOS women. So we usually administer insulin sensitizing agents like metformin and minoxidil, which help in body weight reduction and also improve the hormonal profile of the women. If women are not benefited by this, then we can also add ovulatory drugs like letrozole or clomiphene to increase the frequency of ovulation in the cycle. which will result in pregnancy. Sometimes women are not able to conceive with all of these drugs, so then injectable hormonal medications can also be useful. And last but not the least, IVF treatment is also useful in women who are trying very hard and have not succeeded with any of the above treatments that is listed. But we should be very clear about the fact that IVF is the last resort. We do not need to panic if we are diagnosed with PCOS, because 90% of the women who have been diagnosed with PCOS usually get pregnant on their own. Thank you.